Our facilities that are championing telehealth, them doing 15 to 20% more of their volume through telehealth is helping us keep that facility open. With the coronavirus, the big thing that we noticed was patients were still wanting healthcare accessibility, but didn't quite feel safe. Telehealth became that avenue for us.
When we determined what platform we were going to use for telehealth, within a few days, we had an entire write-up.
A mind shift that we had to have with our therapist was, just because the patient doesn't want to come in anymore doesn't mean we've discharged them from their care, right? They're still under your care. So the best way to offer that is give them telehealth.
I think a lot of it has to do with just the buy-in of the therapists. We've really had a lot of therapists just jump on board this telehealth thing.
Once we trained our front office people on what to say, we started seeing our numbers start to climb on a week-by-week basis. We had a lot of patients that stopped coming in. That was the big aspect, was calling all those past patients and saying, hey, we understand why you can't come in, but we now offer telehealth for you to be able to still receive care.
When we started doing our telehealth visits, the first week we were at about 13 visits scheduled. 2.5 weeks later, we're now a little over 200 total visits scheduled around the company.
Ensuring that a telehealth visit goes smoothly is both challenging and easy at the same time. I think a lot of preparation beforehand makes you feel a little bit more confident. Obviously, you can't provide the manual techniques that you do. You have to get really good with your verbal cueing. Sometimes I can get the caregiver or the spouse or the son or daughter to come in and assist in, overpressure with some stretching or things like that.
Depending on your contracts with commercial payers, everybody could be a little bit different. So what our payers are having us do may not necessarily be what another place's payers are having them do.
For the most part, everybody is reimbursing normal CPT codes with that 95 modifier.
Our expectation is if we're doing it with the patient, we'll be getting the same reimbursement as if they were coming into the facility.
If our state boards allow us to continue practicing it and the payers see the benefits of it, I think it's something that can continue to be utilized moving forward. Really don't be afraid to jump into it. It's kind of a trial and error process. There's a lot of people doing it now. There's a lot of resources out there, so there's people who can help.
I think this is actually a tipping point within the physical therapy profession, meaning that it's not something that's going away.